Good morning. How are you?
I am okay, thank you. Well, you're updating your vaccine targets today. Just tell us when people should expect to get their first dose.
We're able to now set a new target for the vaccine rollout. And the vaccine rollout has obviously been a huge success so far and met all of its objectives. We're now aiming to offer a vaccine to everybody in categories 1 to 9. That's those who are most vulnerable and the over 50s and health and social care workers. And to do that by the 15th of April. And then all adults should be offered a jab by the end of July. We now think that we have the supplies to be able to do that. We can see that the NHS and all of those partners and all of those working on this have been able to deliver jabs at about 500,000 a day, which is an incredible effort. So collectively, the whole team now needs to focus on this renewed target of all vulnerable groups, all those over 50, by the 15th of April. And then we'll keep rolling out and make sure that all adults get access to the jab.
As you say, you're able to do this because the vaccine rollout is going well. There are currently around 500,000 teachers in the United Kingdom. You're doing around 400,000 doses of the vaccine every day. Some people will be wondering that if reopening schools is the priority tomorrow, why not just spend a few days giving teachers their jabs?
Well, the question is the order of priority. And so within that pair of targets that we're setting today, we also obviously need to vaccinate and to offer these jabs according to the order of priority. And we've asked the expert group, the Joint Committee on Vaccinations and Immunisations, what order we should vaccinate in broadly in order to reduce the number of deaths as fast as possible. And I think everybody can understand why we asked that as the question. And they've set out the priority groups 1 to 9, which includes those who are clinically most vulnerable and their carers, and includes the over 50s going down the age range. And they are currently considering after that what might be the best order in terms of clinical priority. And there isn't strong evidence that teachers are more likely to catch COVID than any other group. But I'll leave it for the JCVI to set out what they think is the best order in which to do this that minimizes the number of deaths.
Okay.
I think everybody can understand that as the goal.
The target is to offer every adult their first dose by the end of July. Are you looking into whether children should be vaccinated as well?
Yes, there's clinical trials underway as to whether children should be vaccinated. And of course, there's 2 points here. One is that it absolutely must be safe specifically for children. And so that is being currently investigated. And the second is because children are very, very rarely get symptoms and serious illness from the disease. The importance of vaccinating children is to try to stop the spread of the disease. And obviously, that's something that the impact of the vaccine on stopping transmission is something that we have early evidence of. It looks like the first jab reduces your impact of transmitting the disease by about 2/3, but we need more evidence on that as well.
Okay. Now, if the vaccine programme is speeding along, lots of people are going to be wondering why you're being so cautious on restrictions. You want to vaccinate or offer a dose to every adult by the end of July, but you can't even tell us whether or not we'll be able to go on holiday in the summer. I mean, that does seem to some people, a little bit ridiculous.
Well, I know that everybody at Sky News is keen to be able to get back to having parties, and all of us understandably want to get back to normal. But it is right to be cautious. It's incredibly important. There are still almost 20,000 people in hospital with COVID right now, almost 20,000. And the vaccination program, while it's clearly going very well, will take time to be able to reach all people who have significant vulnerability, especially because we also need to get the second jab to everybody. So we've got we've got time that needs to be taken to get this right. The Prime Minister will set out the roadmap tomorrow, and he'll set out the full details, taking into account that we need to take a cautious but irreversible approach. That's the goal.
Cautious, irreversible approach that some people on your own side are getting slightly twitchy about. I spoke to William Hague this week, who's told me that when everyone over 50 is vaccinated, then there wouldn't be much justification for keeping the restrictions on people. And the top 9 priority groups, who you say will get their first dose by April 15th, they count for 99% of deaths. Is that the time to start looking at easing some restrictions?
Well, it's very tempting, Sophie, to say more about what the Prime Minister is going to announce tomorrow, but it hasn't been fully signed off yet. I'm going to, after this, I'm going to go and keep working on the details of that, and so you'll understand why I'll reserve my what I say on that until the Prime Minister sets out the full details tomorrow.
Of course, I understand that you don't want to say anything before the sign-off from Cabinet, but can you give us a bit of guidance on schools? It's something that so many parents across the country and pupils as well will be watching very carefully. The target, of course, to get pupils back in the classroom by the 8th of March. Do you want that to be all pupils in all schools?
Well, that's absolutely something that the Prime Minister will address tomorrow. I know that. I know the importance of that, and I know from personal experience. We also have seen and set out really very clearly that getting schools back is the top priority amongst all the different things that we want to do to get life back to normal. Getting schools back is at the top of the priority list.
Would it be fair to say, you're emphasising the cautious nature of this. Would it be fair to say that, if you're the aim is to get schools back on the 8th of March, or at least many more pupils back in the classroom at the 8th of March, should we expect to see any other easing in March, or would it be safe to assume that you're going to see the impact of reopening schools before easing anything else?
Well, it is very important to see the impact of steps that we're taking. And the reason for that is because whilst we want to set out a roadmap which gives people guidance in terms of how we think we'll be able to do this, we also absolutely will be vigilant to the data on the way. And we've seen throughout this pandemic that there have been moments when things haven't gone as expected. For instance, when the new variant was first discovered in Kent, and that had a big impact on how we had to manage the pandemic. And we've currently seen other new variants that thankfully there's very, very, very few of in this country now, but we've got to protect against them, and we've got to assess how effective the vaccine is against those new variants, in particular the ones first discovered in Brazil and in South Africa. And we've got to remain vigilant against any new variants. So all of these things mean that you have to watch the data, but we also do want to give that indicative sense and the direction so that people can start to begin to plan their lives in a way that they've all been put on hold for the last the last year, and certainly the last month or so whilst we've been in this second national lockdown. So that's the overall strategy. The Prime Minister will put the details onto that. As I say, after this I'll be going and working on them, and then we'll finally sign them off before he announces. But that's the sense of direction.
Just before we move on, the Sunday Times reporting that the UK is actually offering to host the European Football Championships this summer. Is that true?
I haven't seen anything on that. I understand that that's not right.
OK, thank you. And you mentioned the impact of new variants as well. We know, of course, that this is something that scientists and government are very concerned about. What is the latest data on the South African, the Brazilian variant?
Well, there is evidence that the measures that we're taking, both the enhanced contact tracing and also the stricter measures at the border, there is evidence that these are working, and that we've now got a much stronger vigilance in place, because everybody coming into the country has to be tested, and we sequence the results of those tests. And we've also got a very strong set of actions working with the local authorities, very specifically in the areas where a new variant is found. And we hit it hard and send in that enhanced contact tracing and go door to door. So we've now got this program in place to be able to really try to stamp out a new variant where we see it. And there is evidence that that is working.
So evidence that that's what, sorry, does that mean that you think that cases might be coming down of those variants?
Yes, I do. And we publish data on this. So everybody will be able to see that. So there is evidence of that. But I want to be cautious here because we've got to be vigilant, because if one of these new variants doesn't respond to the vaccine as well as the others, as well as the old, the variant that is now the standard variant in the UK, which is the Kent variant, then if that's the case, then we've got, then that's obviously a very serious risk for the vaccination program. Now, we're doing a lot of work to find out the impact of the vaccine on these new variants, especially the ones discovered in Brazil and South Africa, because clearly knowing the answer to that question is critical to understanding how much of a risk the new variants pose. But the good news is that the actions that we're taking right now do appear to be working.
Okay. Now, you've been found to have acted unlawfully this week by refusing to publish details of COVID-19 contracts. Will you resign?
No, that's not quite right. It's important to be clear on what this court case did and didn't find. The court case did not find that there was a problem with any of the contracts. What it found is that whereas we're supposed to publish the details of contracts within 30 days of them being signed, on average, we published them in the heat of the crisis, on average 47 days after they were signed.
Sorry to come in, because I am careful to be specific. I know that they're not talking about the details of the contracts. That's why I said refusing to publish the details. The High Court judge said there is now no dispute that in a substantial number of cases, the Secretary of State breached his legal obligation to publish contract award notices within 30 days of the awards of contracts. I mean, look, people understand you have to spend money, you have to act quickly in a pandemic. This is about transparency. That matters as well, doesn't it?
That's right. So that's right. The question that you first asked was about a refusal to publish. That's not true. We published the details of all these contracts that we had to publish, absolutely and quite rightly. On average, we published them just over a fortnight later than they should have been. And there's a reason for that, Sophie. The reason is that there was a global shortage of PPE. We needed to buy PPE to save lives. And my officials, with my full support, spent every waking hour buying PPE so that even though we came close, we never actually ran out of PPE in this country. And they did that even though the paperwork got delayed by, on average, just over a fortnight. That's what the court found. And I think any Secretary of State in my position would absolutely back my officials in doing the right thing, saving lives.
So will you now commit to publishing the names of all firms who were given public contracts and how much they were paid?
Well, of course, we publish all the details we're required to publish. And that's been happening all the way through. The fact is that in the heat of the first wave, on average, we were just over a fortnight late in some of these publications. That's what the court case found. That was put right over the summer.
So you will commit to publishing the names and details, the question was?
I'll commit to publishing what is, on the standard basis, what is legally required and what is normal to publish. And we do that. And we have done since the summer. So, the actual substance of this is, how quickly did we act to buy the PPE and other things that were needed to save lives when there was a global scramble? And the answer is we acted incredibly quickly. Some of the paperwork got a little bit delayed, and I'm absolutely backing my team, who did a phenomenal job in incredibly difficult circumstances. And we follow
Okay.
all these rules. We follow them absolutely. The transparency is important. I agree with that. And in fact, in past jobs, I've been responsible for putting some of these rules in place.
Okay.
And I'm perfectly happy with how the team. In fact, I think it's quite important to state on the record, I'm incredibly grateful for what the team did because the circumstances were so difficult.
Okay. Now, talking about the circumstances of the pandemic, during the pandemic, women have been able to take pills at home for an early abortions, up to 10 weeks gestation. My colleague Isabel Webster looking into it this week, without first having to go to a hospital or clinic. And the government's now consulting about whether to make this temporary measure permanent. Now, I know the consultation's going on, but do you think that this is something that should be considered as a permanent change?
Well, I know that this is a very sensitive area, so we have put out a detailed consultation document. People with strong views on either side of this debate should respond to that consultation. We'll look at all of the answers and we'll look at what's been put forward and then come to a considered view.
Okay. Now, last time you were on the show, I asked if you'd been talking to Tony Blair. You very neatly sidestepped the question. A week later, Tony Blair told me that, yes, you have been talking. And now I read in the Mail on Sunday that apparently you stopped talking to Tony Blair because he's pinching your ideas and passing them off as his own. So is the bromance over?
I talked to all of the former prime ministers, as you would imagine, because this is a very difficult circumstance to be in. So I talked to all of them and try to get advice from wherever I can.
Okay. Very neatly sidestepped again. Now, it's been confirmed this week that Prince Harry and Meghan are going to be not going to be returning to their roles as working members of the royal family. Were you sad to see this?
Well, look, I know that this is not a direct answer to this question, but I'm an enormous supporter of the royal family and the incredible work that they do for this country and the leadership that they provide. And I'm concentrating on tackling this pandemic and preparing for the future and giving the NHS all the support that it needs. I think that I think it's best if I leave it there.
Understood. Thank you very much, Matt Hancock, for being on the programme this morning. Thank you.
Thanks for having me.